Welcome. We're here to discuss lifetime fitness for seniors and guidelines to establish an appropriate exercise program for individuals of this age category. First off, let's talk a little bit about physical activity. Physical activity is any bodily movement produced by skeletal muscles that requires energy. This is basically any everyday life activity such as walking, cycling, gardening, household chores, anything that requires movement. Next, we're here to talk about fitness. Fitness is achieved through regular physical activity, proper nutrition, and sufficient rest. It is a state of health and well-being. Next, we have endurance. Endurance is the ability of the body to sustain prolonged physical activity. There are two types of endurance. Cardiovascular endurance, which tells us how well the heart and lungs work together, and muscular endurance, which tells us how well the muscle is performing at a single task. Some benefits of aerobic training are lower resting heart rate, indicating improved heart efficiency, a lower systolic and diastolic blood pressure, reducing the risk of hypertension, increased stroke volume of the heart, which increases the amount of blood being pumped with each beat, meaning that the heart works more efficiently. And last, we have an increase of cardiac output, which improves oxygen delivery to the tissues. There could also be some harmful effects of sitting too much, such as increased risk of chronic diseases such as heart disease, diabetes, and obesity. We could also have muscle weakness or joint stiffness, which with lack of movement can lead to muscle atrophy and joint stiffness, including impacting mobility. Mental health impact can also be affected. Sedentary behavior is associated with increased risk of depression and anxiety. Here are some helpful recommendations for older adults to keep active. Stand up and move every 30 minutes. Incorporate light activities such as walking or stretching throughout the day. A nice walk after dinner would also help improve and keep active. You can also track your progress using a pedometer or a fitness tracker to monitor activity levels. Here are some precautions when designing an exercise program for older adults. Patients must have medical clearance, especially if they have chronic conditions. They should start slow when beginning and begin with a low intensity exercise that gradually increases intensity and duration. The exercise program should focus on balance and flexibility. When improving balance and flexibility, one can prevent falls. Monitor for signs of overexertion. Be aware of symptoms like dizziness, shortness of breath, or chest pains, and monitor vitals. Hydration and nutrition should be encouraged to support physical activity and overall health. These are just some guidelines to get you started when building an exercise program for older adults.